After the age of 60, staying active becomes more important than ever. But standing workouts aren't always safe or comfortable. If you or a loved one struggles with knee pain, low energy, or balance issues, these simple seated exercises could make a real difference. In just 10 minutes a day, you can improve strength, mobility, and confidence without ever leaving your chair. Today, I'm going to show you doctor-recommended seated exercises that are safe, gentle, and easy to do at home. Let's get started. As we age, our bodies naturally go through changes that affect strength, balance, flexibility, and endurance. After the age of 60, muscle mass begins to decline more rapidly, a process known as sarcopenia. This gradual loss of muscle makes everyday activities like standing up from a chair, climbing stairs, or even walking for extended periods more difficult. At the same time, joints may become stiffer, reaction time may slow down, and balance can weaken. These physical changes increase the risk of falls, which are one of the leading causes of injury among older adults. Even a minor fall can result in serious complications, including fractures, hospital stays, and a loss of independence. Because of this, maintaining regular movement becomes not just helpful, but essential. However, many seniors avoid exercise altogether. Some worry about knee pain, arthritis, hip discomfort, or fear of falling during standing workouts. Others may feel that exercise routines are too intense or complicated. This is where seated exercises become incredibly valuable. Seated exercises provide a safe, accessible way to stay active without putting unnecessary strain on the body. By remaining seated, the risk of falling is greatly reduced. A sturdy chair offers stability and support, allowing seniors to focus on controlled, intentional movements rather than worrying about balance. Even though the exercises are done while sitting, they still activate important muscle groups. Gentle leg lifts strengthen the thighs. Arm raises improve shoulder mobility. Seated marches engage the hips and core. These small movements help maintain muscle tone, improve circulation, and reduce stiffness. Another key benefit is confidence. When seniors feel safe while exercising, they are more likely to stay consistent. Consistency is what truly creates long-term results. Just 10 minutes a day of seated movement can help maintain independence, making everyday tasks easier and more manageable. Seated exercises also improve joint lubrication. When we move, we increase the flow of synovial fluid within our joints. This helps reduce stiffness and discomfort, especially for individuals with arthritis. Movement does not have to be intense to be effective. It simply needs to be regular. Most importantly, staying active supports overall quality of life. Exercise contributes to better mood, improved sleep, stronger bones, and even sharper cognitive function. Physical movement increases blood flow to the brain, which may help support memory and mental clarity. The goal after 60 is not extreme fitness, it is functional strength, the kind that allows someone to live independently, move confidently, and maintain dignity. Seated exercises are a practical, safe, and effective way to achieve that goal. Small movements done consistently can make a big difference. One of the biggest concerns for adults over 60 is how to build or maintain strength without causing pain or injury. Many traditional workouts involve standing movements, heavy weights, or high-impact exercises that can place stress on the knees, hips, and lower back. For seniors dealing with arthritis, joint stiffness, or reduced mobility, these types of exercises may feel intimidating or even unsafe. Seated exercises solve this problem by allowing the body to strengthen muscles in a controlled and supported position. When you're seated in a sturdy chair, your risk of falling is significantly reduced. This stability allows you to focus on proper form and smooth movement, rather than worrying about balance. Muscle strength is essential for daily life. Simple tasks like standing up from a chair, carrying groceries, reaching into a cabinet, or walking across a room all require muscular support. Without regular movement, muscles gradually weaken. This can lead to fatigue, poor posture, and increased strain on joints. Seated exercises gently activate major muscle groups without placing excessive pressure on vulnerable areas. For example, seated leg extensions strengthen the quadriceps, the large muscles in the front of the thighs, which play a key role in standing and walking. Seated marches help maintain hip mobility and improve coordination. Arm curls and overhead raises build upper body strength needed for lifting and reaching. The key difference is intensity. These movements are low impact, meaning they do not involve jumping, pounding, or sudden directional changes. This protects joints while still stimulating muscle fibers. Strength does not require heavy weights. It requires consistent muscle engagement. Even light resistance, such as using small hand weights or resistance bands, can be effective when done regularly. Another benefit of seated strengthening exercises is joint protection. Stronger muscles help stabilize joints. When muscles surrounding the knees and hips are stronger, they absorb more of the workload, reducing stress on cartilage and ligaments. This can help decrease discomfort and improve overall mobility. Controlled seated movements also encourage better posture. Sitting upright and engaging the core muscles strengthens the abdominal and lower back muscles that support the spine. Over time, this can reduce back pain and improve alignment. Importantly, strengthening exercises done in a seated position allow seniors to work at their own pace. There is no pressure to keep up with a fast routine. Movements can be slower and more deliberate, which often leads to better muscle activation and safer execution. Consistency is what makes the difference. Performing these exercises for even 10 to 15 minutes a day can gradually rebuild strength. Over weeks and months, small improvements add up. Seniors may notice that standing feels easier, walking feels steadier, and everyday tasks require less effort. The goal is not to lift heavy weights or push the body to extremes. The goal is sustainable strength, the kind that supports independence and protects the body from unnecessary strain. With the right approach, building strength after 60 can be safe, gentle, and highly effective. Balance is one of the most important physical abilities to maintain after the age of 60. As we grow older, changes in muscle strength, joint flexibility, vision, and reaction time can all affect stability. Even small decreases in balance can increase the risk of falls, which are a leading cause of injury among seniors. The good news is that balance can be improved, and seated exercises play an important role in that process. While seated movements may seem simple, they help strengthen the core, hips, and leg muscles that are essential for stability. The core muscles, including the abdominal and lower back muscles, act as the body's center of control. When these muscles are stronger, they help maintain upright posture and reduce swaying while standing or walking. Seated marches, controlled leg lifts, and upright posture exercises activate the hip flexors and thigh muscles. These muscle groups are directly involved in walking and stepping safely. Strengthening them improves coordination and control. Seated exercises also improve body awareness, known as proprioception. When seniors practice slow, controlled movements, they train the brain and muscles to communicate more effectively. This enhances reaction time and stability in everyday situations, such as turning around, stepping off a curb, or getting out of bed. Another benefit is confidence. Fear of falling often causes seniors to move less, which unfortunately weakens balance further. Safe seated exercises rebuild strength gradually, helping restore confidence in movement. Better balance means greater independence. It allows seniors to walk more securely, move around their home with ease, and perform daily activities with reduced risk. Even small improvements in stability can make a meaningful difference in long-term safety and quality of life. Staying active after 60 is not only about muscles and balance, it is also essential for heart health and circulation. As we age, blood flow can become less efficient, and a more sedentary lifestyle may increase the risk of high blood pressure, fatigue, and cardiovascular issues. Seated exercises provide a gentle way to stimulate the heart without overexertion. Simple movements such as seated marches, arm raises, and controlled leg extensions increase blood flow throughout the body. Even moderate activity helps the heart pump more effectively and delivers oxygen to muscles and organs. Improved circulation also reduces stiffness and swelling in the legs and feet, which many seniors experience after long periods of sitting. Regular movement encourages healthy blood flow, which can lower the risk of blood clots and improve overall energy levels. The key is consistency, not intensity. You don't need high-impact cardio to support your heart. A few minutes of steady seated movement each day can help maintain cardiovascular function safely. Over time, these gentle exercises can contribute to better endurance, improved breathing, and a stronger, healthier heart, all while remaining comfortable and low risk. One of the greatest advantages of seated exercises is how safe and accessible they are. Many seniors avoid traditional workouts because they feel complicated, require special equipment, or seem physically demanding. Seated exercises remove those barriers. All that's needed is a sturdy chair placed on a flat surface. There's no need for gym memberships, heavy weights, or complex machines. This makes the routine easy to perform at home at any time of day. The individuals with limited mobility or those recovering from illness, the seated position provides added security and confidence. The movements are simple and easy to follow. They can be adjusted based on personal ability, performed slowly, with fewer repetitions, or with light resistance if desired. This flexibility makes seated exercises suitable for beginners and those returning to activity after a long break. Because the exercises are low impact, they reduce strain on joints while still promoting strength, flexibility, and circulation. Most importantly, they encourage consistency. When a routine feels manageable and safe, seniors are more likely to stick with it. Simple, steady movement done regularly can lead to meaningful improvements in independence and overall well-being.